We're here today with Ed. And Ed, you had a procedure in your neck done recently. We did some PRP for your neck.
Correct.
And I'm sitting over here testing how much you can rotate your neck. So tell me what was going on with your neck before. So you had some issues.
I had limited motion in my neck.
Okay.
I had steroid injections in the neck itself, plus in the nerves coming out of the neck, and they weren't doing anything.
This was before I met you.
Right. Some temporary relief for a couple months, then they want me to come back and do it all over again.
Right. So you saw our mutual friend,
Right.
Dr. Huffman.
Correct.
And he said maybe instead of surgery, you should try this PRP, the Platelet-Rich Plasma.
Right. He recommended me come see you,
Right.
and we discussed it. We worked out
Kind of
a care plan.
That's right.
And after the injections, it was rough for the first couple of days, which you told me would happen.
Right.
And then after that, I had relief from a migraine that I had for 2 to 3 months within a couple days. By the time about 2 weeks hit, I started having more range of motion in my neck.
Yeah, show us what you were doing with your range of motion.
I can go to about there and about there.
Right. And then how are you doing now?
Now I can rotate all the way over to my shoulder on the right, and my left I can get almost that far.
And that's kind of important to you because what do you do for work?
I own an excavation company, and so if you can't see in your peripherals, it's very hazardous to other people around you.
You got to see if there's any knuckleheads around who aren't paying
Correct.
attention to you. So you got to have
Absolutely.
full range of motion, like an owl's head.
Yes. So that has made a huge difference. My right eye is no longer blurry.
Yeah, you were having pain that was coming from the occipital nerve that was being pinched in your upper neck and causing you to have odd blurriness in your
Correct.
vision, in
And-
addition to the pain.
Right. And that was also causing the headaches.
Right.
And after the procedure, it all went away.
Good.
I
So
mean,
we treated that place too.
Yes.
All right.
I can move my neck up and down much further than I could before. When I started, I could go down, but I could only go to about here, looking up. I
Okay.
couldn't tilt it all the way back.
So that's better too. Afterwards, we did some laser, shockwave,
We did the shockwave. We did some
electromagnetic
We
EMTT.
did laser for 6 visits. We did 3 visits of EMT and then 3 visits of shockwave.
So you got the whole kitchen sink.
Yes.
Awesome. All right.
It made a huge difference.
Good.
I'm very pleased with everything that's the outcome.
Great.
And once we get something that's, the shoulder taken care of that's beyond you at the moment,
Yeah,
we
sounds
may be
good.
back
You
for
got-
another round.
You got a little slap tear there. You're going to have surgery in November, and
Right.
I bet you'll do great with that. But if you need any help kind of getting over that initial phase, laser, shockwave, EMTT, we know these things speed up. Even when you have to have surgery, these things can help you to get
Right.
better quicker. So keep us in mind.
Absolutely.
Appreciate it.
Well, thank you
All
very
right,
much.
man. Yeah, you bet.
You have a good